what factors are responsible for suboptimal breastfeeding practices in India?
So if we talk about the factors for suboptimal breastfeeding practices in India, we could largely sort of club them in like 4 buckets. One bucket could be around the social, cultural, and religious issues. There could be one bucket around commercial factors. There could be one bucket around lack of awareness, and of course, fourth could be around health systems. And there could be, more reasons to it. तो अगर हम social, if we talk about social, cultural, and religious issues, we do know that in different parts of our country, so the mother's first milk, which is called the colostrum, the most nutritious sort of milk which comes out, but it's slightly yellowish in color. So in different parts of our country, that's looked upon as dirty milk and often discarded.
Yes, yeah.
I mean, there are certain practices that we have within our cultures and social systems which do not lead to the practice of appropriate breastfeeding. The second is on the commercial factors. So there's an aggressive promotion of infant formula, milk powder, and other breast milk. Then our health systems, most of the times, they're overburdened. Also, in the training of our medical and healthcare workers, perhaps there isn't due emphasis on infant and young child nutrition, and therefore the messages that they should be giving to pregnant lactating women are not necessarily coming forth. And of course, the last is the lack of knowledge amongst the community members, amongst women, amongst the caregivers of young children, amongst their larger families, as well as the policymakers, of not exclusively, the dangers of not exclusively breastfeeding or not knowing the proper breastfeeding techniques.